Hi guys, welcome back to my channel for a new video, the first video basically in a series of video I'll be posting targeted at the MDCN examination. Well, it's common knowledge that the MDCN examination is pretty inevitable. It's a pretty inevitable exam that we IMGs, that's the International Medical Graduates, need to sit for in order to get the ball rolling on our medical careers. And once you are a Nigerian and you studied abroad, you studied medicine precisely abroad, and you want to practice here in Nigeria, the MDCN exam is mostly inescapable. It's also needed for those planning to practice somewhere else, maybe some other country like Germany, UK. I'm sure of that. UK, Australia. Most of these countries would require you to have a minimum 1 year clinical experience. That's like an internship, either in your home country or in your country of study. And if you want to do the internship here in Nigeria, it's pretty impossible to do an internship without getting licensed first and then subsequently getting inducted to the MDCN here in Nigeria. And to get licensed, you need to write the exam. So in this series, we'll be delving into the nitty-gritty of the examination. We'll be looking at the purpose of the examination. Why do we need to write this exam? The structure of this exam. We'll be looking at the preparation process, the strategies for better preparation. I'll be talking about my experience and the experience of other doctors who've passed through the same procedure. We'll be looking at study tricks. We'll be looking at mnemonics we've used. We'll be looking at useful acronyms and which will certainly make the exam walk in the park for anyone who's looking at writing this examination and make sure passing is most certain. So why did I decide to start this series of videos and go through the hurdles of making all of these videos? Well, besides the fact that I enjoy the medicine as a whole, the practice of medicine, what it entails, I also have seen and come to understand that I have a predilection, I have a fondness for impacting knowledge, for teaching and all of that. And besides that, I've come to realize that from experience, basically, that we've been made to be what's the word here, wrongly apprehensive of the exam. That is, I believe, is secondary to the limited resources that most people have when coming into the preparation of this examination. Most people come into the preparation with little or no knowledge at all of what the exam really entails and how to navigate the exam and the preparation for it. There are very few online resources detailing the exam, and I just want to be of help in bridging that gap, that knowledge gap, and making it less burdensome on subsequent doctors who will be writing this examination. And as someone with 4 years experience studying medicine in Nigeria, that's in a medical school in Nigeria, and then transferring from here to another country outside of Nigeria, studying abroad medicine for another 5 years, uh, I believe I've seen both sides of the coin. I believe I have enough relevant experience of understanding both sides, both worlds, and I believe that could give me first-hand experience in relaying what is really needed for the exam. What does the Medical Council of Nigeria really expect of us coming into this examination? So I'll be helping clarify that from the little knowledge I have based on these things. And so with that being said, let's get right into today's video. Obviously, it's Dr. Tolu Ajibade. So let's look at what we'll be doing today. The schedule basically involves number one, what MDCN really means, the purpose of the exam, the structure of the exam, and the lead up to the exam and testimonials, as I stated earlier. The structure and the lead up. Okay, and then talking about the MDCN itself. So what is MDCN? What does it really mean? Okay, so what are the values of this uh, uh, council? But before we talk about the values, I would like us to talk a little about MDCN. It means the Medical Dental Council of Nigeria, and some of the values are, courtesy, transparency, efficiency, prompt services, and effectiveness. So there's very well acclaimed to be very courteous and all of this and very transparent. And I was speaking to a professor from Cameroon who had a sabbatical in Nigeria here, and he was talking about how transparent this council is. And I also have a first-hand experience, with an accreditation team from this council, and saw how really professional they were. They were looking at the fact that their colleagues were some of the people they were screening, their own colleagues, but they still maintained that level of transparency and efficiency and all of that. And then uh, we'll be looking at the functions of, let's look a little about the functions of the MDCN, about the Dental, Medical and Dental Council. So, for example, one of the functions and one of the duties is maintaining the standard of knowledge and skill in the medical system of Nigeria. For example, if you're an house officer, they want to know, okay, do you know what is needed to be a house officer in Nigeria? If you're a consultant, they try to say, okay, do you know what is needed? And then they also establish and maintain a register of persons entitled to practice. For example, you could go to the website and then search for a particular doctor. Maybe you want to be sure, oh, this doctor who runs a private clinic, is it really licensed? Is it really, uh, can I trust in him? Can I count on this person? And then you look through it, you see the list of quack doctors, you see these registers, and you can even confirm from any of their offices in any in Lagos and the other states. Okay, and they also they have a code of conduct system where they, they 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 prepare this. It's like a rule book, if I may say, that guides the medical practice in Nigeria, and they give you all of this. So you being a part of the medical council, if you're licensed under the medical council, it means you need to be led by these rules. You need to go by these rules. You don't break the rules. You don't do anything that is against or in contrast to these rules. So they make sure they review these on a regular basis and also, you know, maintain that. And let's look at, apart from the basic contemporary medicine we all know, there are also the forms of medicine like homeopathy. We have homeopathy, we have alternative medicine, which is really making waves in Nigeria currently. So this body also makes sure that this widespread practice is very well maintained, because whatever is done in the alternative medicine uh, directly or indirectly affects those practicing the regular contemporary medicine. And then they also perform other functions that are assigned to them at particular times by maybe by the Senate or by the executive arm of government. Sometimes they're told to go outside of the box and then do some extra duties that are conferred to them. And then they also help in making regulations and rules and all for the operation of clinical laboratory practice. These things go hand in hand with medicine, so you can't have a faulty medical practice and then a good clinical laboratory practice. You can have a bad clinical laboratory practice and a good medical practice. So they work in tandem. So they make sure that there is an equilibrium in the operation of these several bodies. So the exam itself. So what's the purpose of this exam? Okay, let's imagine a scenario where you're not a doctor or anything, and then you go to the hospital for something really that's really affecting you, that is really a burden on you, and then you hear that the doctor who is attending to you hasn't really been tested or hasn't been screened in any way, and he or she may have the knowledge base to treat you, or he or she may not, and that could either worsen your case or make it better. How confident will you be in that? How confident will you be in that system afterwards? Would you be ready to go all in and to just turn a blind eye to all of that? I don't think so. So that's exactly my point. They make sure that there is there is a standard to making sure that this exam actually places that standard, making sure there is this um, making sure patients get the best possible treatment, uh, builds trust in the system, builds trust in the doctors, and it also prepares people for the task ahead, mentally, knowledge-wise, skill-wise, even emotionally, because the medical career isn't a bed of roses all the time. There are little bumps on the road. There are times when you feel down. There are times when it becomes really burdensome on you. This several hours of calls and overtime, and always putting your patient first and all of that. So it could be sometimes emotionally taxing, and it could be even the fact that you have to study a lot all the time. You have a new case, maybe you've never encountered this as a junior doctor, but you have to go learn and read about it for hours while balancing that with your regular routine. So it's a sometimes difficult system, or let me say really challenging system to get into and devote your life into. So they want to see, okay, how ready are you for this task ahead? Can you devote 3 months dedicated period of your life to preparing for such an exam and pushing you beyond your mental limits, beyond your knowledge limits, beyond your skill limits, emotional limits, just to prepare you for the task ahead. So that's how I say it. And also, it sets your focus. We know in medical school you have a myriad of things to learn, several things like that. But in this exam actually helps, streamline your focus and make sure that you focus on what is major. There's something they used to tell us in medical school back in Nigeria back then. For those would say, so several years they kept saying, major on the major, minor on the minor. And then it helps you build your knowledge on basic endemic, epidemic diseases or health challenges in this region. Because most of us, like, if you're writing this exam, it means you studied in a different geographical zone. It means you studied in a different country, maybe a different continent. So, and in those continents, you have different endemic diseases. You know the diseases that are very prevalent in those places, and then it brings you back and makes you understand, okay, this is Nigeria. What do you need? What will you be seeing on a daily basis in Nigeria? These regular diseases you'll be seeing very frequently that you may have not seen throughout your stay in medical school back in wherever you studied. And then it builds your confidence level. Once you graduate medical school and there is another exam you have to write, it makes you feel like, oh, am I really a doctor? Do I really have what it takes? Why do I have to be tested again? Maybe I'm not competent enough. But once you've gone through this rigorous study, you've put your all into it, you've learned a lot from group tutorials or whatever you do, the books and all of that, and then you see your name on the list. It just your confidence level just skyrockets. You begin to feel very confident in yourself as a doctor. You begin to feel bold enough to walk into the hospital and treat a patient. So it just helps you to boost your confidence level and function under pressure, like I mentioned initially. So it prepares you for that pressure work. You know, that level of pressure you're walking into, because it comes with the territory. It's our job description. And then let's talk about the exam structure. What does the exam really entail? How is it designed? The exam is divided into two parts. We have the CBT, which is a computer-based MCQ exam, MCQ multiple choice questions. And in total, there are 300 multiple choice questions. And we'll be looking into what that really entails. And then you have the OSCE section, which is just as important, uh, if not more important. We'll be talking about all of that. So the OSCE section is full named Objective Structured Clinical Examination. There are 11 stations, and we'll be looking into that in a bit. So for the CBT MCQ, I told you there are 300 questions. So out of the 300, we have 50 picture tests. And what is the meaning of a picture test? It's where instead of a case, a clinical case where you get to pick the answer, or just a random question where you get to pick the right answer out of. So MCQ basically means there's about 5 choices and you pick the correct answer. It's not the true false. Back in medical school in Nigeria, they used to do this system where you have true. For every option, you need to choose if it's true or false. So that's like 5 answers per question. But this isn't that case. In this case, you just pick one right answer out of the others, out of the 5 you've been given. So for the picture test, instead of giving you just a random story, you have a picture, and then a question comes out on that picture. We could be getting deeper into that when I delve into more videos on these topics. And we hear it's really weighty, like it carries a lot of points eventually. We hear out of 50 questions, these 50 questions are summed up into 40 marks out of 200 for the whole examination. So that's a whole lot. That's almost 1 question per mark. And we can't say precisely, but that's the gist we hear. So 50 picture test and then 250 other MCQs from different areas of medicine. You have basically majorly from obstetrics and gynecology, pediatrics, internal medicine, and surgery. Sometimes you could have from pharmacology. Yes, that's a thing. You could have from anatomy, your basic medical sciences, physiology, biochemistry, but focus on the 4 of OBGYN, pediatrics, internal medicine, surgery, and you'll be okay. If you have time, then delve into the others. And then something you need to know is that you need to finish all of this in 180 minutes. I put it in minutes so it doesn't seem long, because if I said 3 hours, you'll feel, oh, 3 hours is a long time. But believe you me, 3 hours is barely enough to finish it up in a regular day-to-day pace. So you need to work on your speed. If you're doing mocks, don't just answer MCQs with if you're doing mocks before the exam, don't just answer MCQs with regular. Try to answer it as fast as possible, as correctly and as fast as possible. Going into the exam, I thought I was going to be able to run through the questions and then go back to it and review. But the real facts, what happened on the D-Day was that I had to just rush and finish up. I made sure I finished everything. Made sure I chose an answer because they keep telling us there is no negative marking. So make sure you pick an answer for every single one of the questions, because there's nothing to lose there, and you will be fine. So pace yourself, figure it out. How do you plan on doing this? How do you plan on allocating your time? How do you plan on working around the time for the exam? Practice this. And one advice I'll give is do the picture test first, considering the fact that it carries a lot of mark. I also learned that the 250 questions for the MCQs will be rounded down to 60 marks. So that's about 4 questions for 1 mark, compared to almost 1 question for 1 mark in the picture test. So start with the picture test. Allocate more time to it if you have to. Then allocate your time well for the MCQs, the 250 MCQs, and you will be fine. Just make sure you finish everything in due time. If a question is taking too long, move on. Don't get stuck on a question, okay? So let's talk a little bit about the OSCE, the 11 stations of the OSCE, and what it really entails. So in these 11 stations, you have 11 rounds. When I say 11 stations, it means you're put into like a loop thereabout, where you have a large room and then 11 tables or 11 chairs and tables, whatever, or beds, depends on what you're doing, what you're being tested on in each station. So you have 11 locations like that, and then an examiner is on 10 of those stations. Now I say 10 because 10 of those stations are tested stations. So you get tested at 10 of those stations. Either a question is asked, an examination is asked from you, and the likes. And then 1 station is for you to relax. You understand? So you'll just be relaxing at that station, watching other people, reminiscing on what you've done, focusing on the future, looking at what you're going to how you're gonna, plan your mind and plan your time for the rest. So 11 rounds, 10 tested stations, one rested station. And let's look at the time. Okay, let's look at the time before that. For the time, you have 5 minutes for each station, including the rest station also, 5 minutes each. So that makes it about 55 minutes of OSCE. But believe you me, the 55 minutes passes like it's just 5 minutes because you're just always on the move. You can't spend more than 5 minutes at the station. Once the bell is rung, you have to move to the next station. But it's great that for those that haven't done an OSCE examination before, you get to be given trial of, like, how was it called, test rounds. When you get into the hall, you're shown, like, you're giving examples on how the movement should be, the segue and the flow of the movement, so there isn't any bottlenecks or any collisions, you know so it makes sure the whole thing flows round. So don't worry, you'll be run through the whole process and it will be fine. So 5 minutes per station. But what I'll tell you is, when you're preparing, prepare like it's 4 minute stations. So I didn't use the 5 minutes as a timer while preparing. Like if I'm doing the physical examination, or let's say I'm clerking a patient while I'm learning to clerk a patient or practicing my clerking. I'll make sure I click the disease and finish. For example, if it's tuberculosis, yeah, I'll make sure I finish clerking at 4 minutes, or 4 minutes, yeah, there about 4 minutes, and like a week to the exam, then I started practicing how to use 5 minutes, because sometimes I just realized it could be really messy finishing up your exam in 4 minutes, and then for 1 minute you're still at that station looking at the examiner, looking at the patient, like, what do you do with the time, So I started practicing with 5 minutes a week to the exam, and I would advise you do that as well. So practice with 5 minutes. So for clerking, what I did while practicing for the 5 minutes was, I extended the time of the last point I did. That's system review is the last part of clerking you gotta do. We'll talk about that in subsequent videos. So I just made sure that I asked a lot of questions in a more relaxed manner. So I began that I'll just, if it's tuberculosis, for example, then I ask, oh, have you been experiencing any difficulty breathing? Have you been experiencing any fast breathing? Do you think you've been experiencing your breathing has been noisy recently? Have you had any episodes where it was really difficult breathing and you felt like you were breathless? Do you feel like you've had changes in your voice recently? So it became really, I made it really calm there, as compared to or in contrast to the way I would have been running it for the first 4 minutes. Because there's a lot to ask for. I'll be asking these questions really hastily, but when it gets to the last minute, when I get to system review, I relax and make sure I spread it out so I don't get stuck, and make sure I spread it out so I don't get it doesn't become awkward when I have nothing else to say. You get. And if you finish one system, you could pick the next affected system and then talk about it. And then we hear one needs to pass at least 5 stations to pass this exam. It's been on the screen for a while now. So 5 stations you need to pass. That's what I hear. And you can't just say, okay, I got 10 in 4 stations, and then I got 1, 2, 3, so that's 40, and then 50. Somehow, no, you need to pass more than 50% in each station for at least 5 stations to get a pass mark in this examination. You get it? So, to pass this exam, a candidate must get at least 50% in each section. So you need to pass the MCQ and you need to pass the OSCE with at least 50%. So if it's 300 questions, you need to pass, I don't know, okay, just 50%. I don't know how it's graded, but at least 50% in each part. So that's not extremely difficult to get. If you're used to the MCQ system of Nigeria, it's also not so difficult. Just know it's no one is out to get you. Just trying to see if you can think your way around it. If you can do some, what's it called? lateral thinking. They just want to know, can you think and muster up ideas from your knowledge from just reading? Because that's real life. No one comes present to the hospital with a textbook case. Most times, you have to figure it out in a way. And then for the OSCE, I would say the easiest section to prepare for is the OSCE, because in a way you kind of know what is going to be expected of you. You kind of know the examinations you're going to be faced with. For example, some recurring stations are analysis. In analysis, I grouped patograph. Patograph is the patograph is a system used to monitor labor. The active phase of labor. So it's really simple where you record these things on the charts. There are things you have to record every 4 hours, every hour, every 30 minutes, every 2 hours. So you just monitor the progression of labor to see if it's getting complicated, if it's getting prolonged, and know if to go into a cesarean section or if to induce some contractions more and the likes. And then so you learn that. That's really easy. You could learn it in 2 hours. You're fine. Just practice and practice. Print out pathographs, plain empty paragraphs, and then fill it using cases, and you're fine. And then lab analysis. We'll be going deeper into all of these things, so don't worry. Just stick to this channel, and you will be fine. Lab analysis, that's where you have a test. It could be uh, a complete blood count. You need to know how to read that, how to interpret that. You need to know how to interpret analysis like CSF samples. You need to know how to interpret samples like urinalysis. You need to know how to do urinalysis, etc. We'll get into all of that when we get to lab analysis, okay? And then, yeah, electrolyte counts, electrolytes, imbalance, and the rest. For example, for my exam, I had two. One was a case of acute renal injury, which was secondary to a particular infection. I've forgotten precisely. And then we had thyroid, yeah, thyroid function tests. T3, T4, TSH, and the like. So we had to know, is it what type of thyroid problem is it? What type of. So all of these things, not no big deal. You just learn it and you know it. That's all. And then clerking. You cannot do without clerking, 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 because this is very vital to our practice. So it's basically a detailed history of a case uh, from the patient or from the relatives of a patient. And we'll be looking into all of this. I have videos dedicated to all of these sections. And then counseling, where you talk to a patient, either you pass bad news to a patient, or you talk to a patient about a particular procedure, or you talk to a patient about um, medication, how to use a medication, how to breastfeed, about HIV testing, things like that. So you learn all of these things, and you'll be fine for the exam. No big deal. It just takes regular practice, regular practice. And then levels of prevention and general knowledge of disease dynamics in the country. You need to know, listen to the, listen to the news, read articles, especially during the time of your exam, and you see diseases that have been maybe really really a pain in the neck or for the country, or epidemics during that period. Just learn on that and you'll be fine. We'll talk about this. I have a video on that also already made. Just waiting to post it. Maybe immediately after this video. Okay, then we have the physical examination, where you examine a patient. And most people will learn about 5 basic examinations. They learn general exam, abdominal exam, thyroid exam, uh, respiratory exam, cardiac exam. But what I would say is, I was focusing on just about 5 or 6. But what I would say is, learn everything. Learn every single examination. Some days to the examination, I began to revise how to examine all the cranial nerves. Somebody just told me, oh, revise the cranial nerves. I revised how to examine all the cranial nerves, which I eventually found out were really easy. Lower motor neuron examination, upper motor neuron examination, spinal examination, anything can come out. So learn as many physical examinations as you can. There are videos for this, okay, and you'll be fine. We'll talk about that in a bit. Uh, so system review, this is where you learn particular symptoms that could be present when a particular system is affected. You understand? For example, if it's the central nervous system, you could have symptoms like abulia, aphasia, apraxia, uh, aphasia, you could have hysterexis, you could have acroesthesia, you could have diplopia, you could have dyskinesia, dysgraphia, dysarthria, you know, things like that. Neck stiffness, all of those things. So, what I would advise is learn at least 15 of these symptoms for each system, and you'll be fine. Because in the exam you're tested on maybe 10 or 12. So if you know more, the better. The more you know, the better. Okay, and learn the most important symptoms. Don't just learn random symptoms that are not really directly related to the system in question. Okay, so for the next section, which is the study plan, I would like us to just move this to the next video. So I've divided this video into two parts just to be sure that we don't get bored by one of the videos and we could take a break. So just click on the link down here to get to the next video where we talk about study plans and all of that good stuff. Alright, see you in the next. Don't forget to like, subscribe, share, and tell a friend, okay? And also, give this video a big thumbs up because it really does help a lot. So see you in the next video. Bye for now.